Hello, my name is Wendy Dawes, and I'm here with my colleagues Raha and Abigail, and we're from the George Brown College. We're practical nursing students. Today, my colleagues and I will be addressing the concerns of a 16-year-old patient who was just diagnosed with type 1 diabetes by providing him with patient teaching and ensures cultural sensitivity, patient involvement, and practical learning skills. So at the end of this session, the patient will be able to know how to administer insulin, how it works, and know what type 1 diabetes is. Also, the patient will demonstrate how safely to administer the insulin on himself, and we will provide referrals and some resources at the end so that he will be able to get assistance in the community.
Hi, my name is Rahul Mahmood. I'm a nursing student. Now we're doing a demonstration how to teach a patient a subcut insulin injection. So before I came to patient room, I have to make sure that I check my MAR and then check the prescriber's order and gather my equipments, which are insulin pen, gauze, and then swab, alcohol swab. And before I came to my patient room, I have to do hand hygiene. I'm gonna ask for consent to come into my patient room, and then I'll identify my patient. So now that I have all my equipment, I identify my patient. I'm gonna have the demonstration with my patient. I'll start with asking my patient what their teaching way they want to look like, because I know my patient wants to have their traditional way of healing in order to get their treatment done. So hi Abigail.
Hello.
So I'm here to give you your patient education about how to administer insulin injection. So I heard you want to collaborate that with your indigenous way of healing. Can you tell me more about your healing process?
Oh, okay. Our family actually believes that we believe in balance, and we believe that our body, our spirit, and our land are all connected. And so we practice smudging, which will help us relax, that aid us in illnesses and any stress that we have. We also make sure that we eat healthily, because we believe that everything that we need is all in the nature.
That is beautiful. So would you be open if we try to collaborate in respect of your indigenous culture with the medical, Western medical? That means that what I'm going to show you to do the injections, we try to collaborate it. Would you be open to that idea?
Oh yes, that's amazing.
All right. So as you said, the world needs balance, your body, your spirit, and land, right? So that's what happens when you are diabetic type 1. When you have diabetic type 1, that means your body doesn't produce insulin. So for your body to balance, we're obligated to give you insulin injection so that you can function the same as the land needs sunlight, rain, so that it keeps giving us the production that we need, right? So for now, I will show you how to do your injection, which is insulin pen, because you're going to be soon discharged from the hospital.
Okay.
Is that okay if I show you how to demonstrate that?
Yes, please.
Perfect. So what you're going to do is at home, you have first to clean your hand, the same as when you do your spiritual healings, you need to clean yourself, right? So the same, you have to clean your hand.
Okay.
You do hand hygiene. That's why I'm going to do hand hygiene. There you go, hand hygiene.
Thank you.
And then you make sure you check your insulin medication if it is not expired or not, because if it's expired, we don't use it.
Okay.
And then you have your pen. This is the instrument that we're going to use. So you see this is the dose that we arrange, and then this is the dial, and then this is the cartridge that we use. I'll show you this. I'm going to open it. So you see this? This is the units that we see, and then we put the insulin injection needle in here. So now I have the medication here. I make sure I have the right dose. And then before I even inject myself, what I'm gonna do is I need to put the needle in. Okay? So you put the needle and then you rotate it clockwise and make sure it's attached to the pen. And then now what we're gonna do is we have to put 2 units so that you can prime your needle. That means you have to inject it, not in your body, just to let the flow of the liquid out. So you see that, and you injected it to, see that?
Yes.
2 units, and then that means you primed your needle. Now what do we do? we have to arrange our dose because we have to arrange it with the prescribed dose that the doctor ordered for you. You know what the dose was the doctor ordered for you?
He said 4.
Yes. So you put 4 units here. And now when you put your dose, you make sure you have your size. You select your site. That means where you can inject your body. So last time we talked about the size of injection. Do you remember that?
Oh yes, you said I can put it here, I can put it in my arm, and I can put it in my tummy.
Of course. So which would you prefer?
I would like to do it in my tummy today.
Perfect. Would you mind opening your tummy for me? Great. So when we're injecting insulin into our tummy, what we have to make sure is, can I touch you?
Yes.
From this belly button, we have to go away 2.5 inches to the right, and then to the left, and then up and down. Okay?
Okay.
So, because you're not gonna know how 2.5 inch means, so you just measure your hand, put your hands, and then
3 fingers.
Yes, and then that's 2.5. So where would you like to inject?
I would like to do it here.
Okay, so perfect. So now we pinch you. Hold on. So we have to clean it. We have to swap it.
Okay.
There you go. Here, you swap. Clean
Like
your
how
injection
long?
site. Let's check for just 10 seconds. You clean it and then let it dry. Yes. And then once it's dry, you make sure it's dry. So what you can do is just pinch your skin.
Like this.
Yes, you pinch your skin and then hold your pen straight.
This.
You make sure your dose is arranged to 4 units.
Okay.
And then you hold this. And then what degree are we going to inject it?
I think it's 90.
Yes,
I have
either
to-
90 degree or 45 degree, but 90 degree is way easier. Just now you go straight up inject your skin, and then you push this button so
Okay.
that the medication goes all in, and then we count
Until 10.
10. So let's count to 10.
2, 3, 4, 5, 6,
7, 8, 9, 10. Now we can leave this one and then straight up take it off. Now we can leave the pinched skin. Leave that. And then you just put 10 on your injection site. Just hold it, don't massage it.
Okay.
And what are we gonna do with the needle?
We're gonna throw it out.
Yes, we're gonna throw it out, but we're not gonna throw it out anywhere. We have to make sure that we throw it in a safe sharpie, okay? So we put it in here.
Okay.
Is it clear?
Yes.
Do you have any questions how we administer this?
No.
Oh, so remember that I said before you have to roll it in your hand before you administer that. Okay? I'm sorry, I forgot that. So roll it. You're not gonna shake it. You're not gonna put it like this, shaking it, but you just gently do roll it. Okay? Or maybe you can just be like up and down slowly. Okay, so that the medication get mixed.
Okay, how long do I have to roll it?
It's just for 10 seconds you have to roll it. Or maybe you can count 10. Okay? And then now you safely can inject it the way I showed you.
Okay.
So when you put the needle, and then what do? You prime it. You choose your injection site.
The swab. like
Yes,
the
swab,
kid,
you
and then
clean it,
inject
and
at
then
90
inject
degree.
90 degree.
Hold for 10 seconds.
Yes, or
and
count to
take it
10.
out. Yeah.
And,
Take it out.
and
And then throw the sharps in the sharps.
perfect. So now you know how to inject your insulin pen at home. Do you have any question?
No, not so far.
Not so far. So I printed you all these information and how to inject yourself in insulin pen at home, so you can see that. And then there are some resources that I mentioned that if you want to check at home or videos to watch.
Okay.
And then if you have any questions, you're welcome to ask.
Okay.
Hello. So we realize that you have
Yeah, friend of mine.
interest in administering your insulin, which is very
Imagine.
important. So we wanted to
So,
know that moving
You want a
forward,
business idea?
we have made a list of community
Well, actually, no, you gotta
centers
buy
where you
those,
can
so
go
it's not
and
gonna work.
get
Yeah.
assistance, ongoing support.
Imagine.
And these
Like,
are
like,
all
that was the craze.
accredited
And
by
then
the
online,
elders
she sold
and
them all
leaders of the
online.
community.
Sold them
And
out.
they have greenhouses
Imagine.
where you can get
She had a little,
they have
she had a
activities
tchotchke
to keep you
store.
healthy, just to keep you
Little
going.
souvenirs.
And we also have link with the video. So in case you forget any of the steps for
she
your
was very
consultation, you can
entrepreneurial. I
refer to
know.
it. And there are numbers and addresses for the community center. So feel free to call at any time. They will support you.
Thank you.